Did you know that approximately 1 to 3 out of every 1,000 babies are born with some degree of hearing loss? And with hearing loss, early detection is key to success. Stick around because in this video I'm talking about newborn hearing screening, why it's crucial, how it's done, and what to expect of it. Newborn hearing screening, often performed shortly after birth, is a simple yet essential procedure that can detect hearing issues early. Before I dive into the screening process and what to expect, I want to address why it's so crucial. Detecting hearing issues early can significantly impact your baby's development, speech and language skills, and overall quality of life, including their future success at school and at work. Therefore, it's not just about hearing, it's about giving the child a best possible start in all aspects of life. Imagine this. You're speaking softly to a newborn and they don't react or turn towards your voice. Sounds scary? Early detection through hearing screening can help identify potential hearing issues, enabling you to take action as soon as possible. So when should you schedule your baby's first hearing screening? And should you schedule it yourself? Newborn hearing screening is typically performed shortly after birth, before you leave the hospital or birthing center. So normally you don't have to do anything yourself. It's quick, safe, and usually doesn't cause any discomfort for your baby. There are two primary tests used in newborn hearing screenings: the otoacoustic emissions test and the auditory brainstem response test, also called as OAE test and ABR test. But what do these tests involve and what should you be aware of? The otoacoustic emissions test, also known as OAE, involves a small probe fitted with a microphone and speaker being inserted into the ear canal. It is a soft earpiece that resembles a mini earbud, so nothing to worry about. The child hears a soft clicking sound in the ear during the test, and the microphone picks up the sounds generated by the inner ear's outer hair cells in response to these clicking sounds. The procedure is quick, typically taking just a few minutes per ear, and is painless. If your child passes this test, it generally indicates that the outer hair cells are functioning well, and this usually correlates with normal hearing. But it is important to emphasize that this test will exclude moderate and severe hearing losses, but it might not detect mild changes to hearing. This is one of the reasons why it's important to monitor a child's hearing abilities during the first years of life, even if they've passed the screening. I'll discuss what to watch for a bit later in this video. Just so you know, it is possible for the child not to pass the test the first time without there actually being a hearing loss. I will talk about it more very soon. The ABR test is usually a test that follows OEE. It monitors your baby's brain wave activity while they listen to sounds. This test provides additional information about the auditory nerve's response to the sound. During the test, electrodes are positioned on the baby's head, and either a small earphone is inserted into the ear canal or a headphone is placed on top of the ear to deliver sounds. The test is also non-invasive, painless, and it usually takes 15 to 30 minutes to complete. It's often performed while the baby is sleeping or lying quietly to ensure accurate results. But you might think, what happens if your baby passes the hearing screening? Does that mean they'll never have hearing issues? While a passing result is very reassuring, it's important to know that hearing issues can develop later. Regular developmental milestones and interactions with your baby can help you monitor their hearing progress. Your baby might show signs that could suggest a hearing concern. These include not responding to loud noises, not turning towards sound or voices, being unaffected by comforting sounds or familiar voices, showing no interest in noise-making toys, failing to react to expected sounds, or only responding when they see you instead of hearing you. Another potential sign is a delay in speech and language development, although this may not become evident until later in infancy. It's important to remember that these signs alone don't definitively indicate a hearing problem, but serve as indicators that further evaluations may be needed. But what if your baby doesn't pass the hearing screening? First, I'd like to reassure you not to worry too much, as it's not uncommon and it doesn't necessarily mean they have a permanent hearing loss. First and foremost, the most frequent cause of test failure, especially in the case of OAE test, is background noise. This noise can originate from either the room or the baby itself. If the baby is restless, they actually make a lot of noise with their body. And the test is highly sensitive to such disturbances. Another common reason for the OAE test to yield inconclusive results is when it is conducted too early and there is still residual birth-related fluid or amniotic fluid inside the baby's ear canal. If a child doesn't pass the test on the first attempt, it is always repeated before considering further referrals. If the child does not pass the second time around, further tests will be conducted to determine the cause and extent of the hearing loss. The goal is to detect hearing loss as early as possible to provide the child with appropriate interventions, whether it's hearing aids, cochlear implants, or another solution. Early intervention is something that can significantly improve your baby's auditory abilities. I want to emphasize that if your child does not pass these tests, and it seems unbelievable to you because no one in the family has a hearing loss, please do follow through with the further tests and appointments your child was referred to. Actually, approximately 90% of children with congenital hearing loss are born to parents with no hearing issues. You might be surprised that some parents don't go do additional testing with their child when they are told to, but it does unfortunately happen. As parents and caregivers, your role is vital. If you ever suspect your baby is experiencing hearing issues, despite passing the screening, trust your instincts and consult a healthcare professional. Talk to your GP, pediatrician, or consult an ENT specialist or audiologist, depending who is available to you. I hope this information empowers you to take the necessary steps to enjoy your baby's auditory health and also alleviate some of the concerns that may arise. The time around birth can be hectic, and you don't need additional worries or confusion when your child undergoes hearing screening, without knowing what it entails or the implications if they don't pass initially. If I was able to ease these concerns even just a little, I'm delighted. Thank you for your time and tune in again next time.